2 days after Arizona's new abortion law had taken effect, they're already screwing up people's lives. A 14-year-old with rheumatoid arthritis and osteoporosis was denied her medication. Why? Because pro-lifers would rather have a 14-year-old crippled in a wheelchair in pain than for somebody to do something that literally never happens. Because once again, methotrexate, which is only ever used in ectopic pregnancies, which according to pro-lifers is fine and not a problem whatsoever, it's not even an abortion. Yet they keep making it illegal. So now this young lady will get to start her first year in high school in crippling pain at home. No social life or any friends, just on the off chance that someone might try to take methotrexate to have an abortion, which has happened a total of 0 times. Perhaps if she was Edward Thomas, she would be able to attend school. They must really want children to transition. Well, moving on. So what other fresh hell does Arizona have to inflict on women? Isabel was 36 weeks along when she found out her son had trisomy 18, where 95% of fetuses are miscarried or stillborn, and the other 5% die shortly afterwards. So everything was all set to induce labor and allow her to say goodbye to her son. When the government said, how can we make this harder on her? How about anytime there's a miscarriage, there's a potential criminal investigation? How about we allow attorneys to override doctors' professional advice and directives and never consider the mother's mental health or well-being? Well, that's downright diabolical. Let's do it! So Isabel was unable to honor the end-of-life decisions that they had made for their child. Because pro-lifers know best. Even when it seems like they have no fucking clue what they're doing.
Recent ultrasound, a 25-year-old woman excited to be 15 weeks pregnant with her first child found out devastating news. Her family says doctors told them there's a more than 90% chance the baby will not survive the pregnancy, as she has fetal hydrops condition, which is an abnormal accumulation of fluid, as well as Turner syndrome and other genetic abnormalities.
They were told that normally somebody that would be getting this kind of news would immediately go have an abortion.
The family says they're also concerned about the health of the mother, as doctors believe she may be developing what they call mirror syndrome, which is rare and potentially life-threatening. In addition, she's also dealing with severe swelling, high blood pressure, and liver enzymes more than double what they should be. However, under the Texas Heartbeat Act, abortions are illegal past 6 weeks unless the mother's life is in danger.
And when asked what will be enough to make her sick enough to warrant a procedure, we were told basically liver failure, basically a stroke, basically a 911 call.
Situations like this is what Lee Bar-Ellie, a local family physician who is not this patient's doctor, says she feared when this law took effect.
It's not the standard of care. OB-GYNs in Boston would have offered her an induction. And we can't live in a country where OB-GYNs in Boston offer someone an induction and OB-GYNs in Texas are sitting around asking lawyers and ethics committees, at what point is she sick enough that her life is in jeopardy?
A law she says is ambiguous and unclear, has this family in a state of heartbreak and worry.
I'm concerned that time is of the essence. And every door we keep trying to open here in Texas, in our hometown, every door we keep trying to hope helps us, gets closed on us.